hasn't been well covered. Companies like United Health Group, this is the nation's largest healthcare insurer, they can't make money on Obamacare. They lost about $500 billion last year. They say they'll lose $650 billion this year. That's $1 billion for a company that should be able to make a go of it and can't. They're pulling out. So you see a lot of trouble for insurers right now. It's going to end up in either giving them more money or giving bigger subsidies to people who are on Obamacare. That's the only way this works. It's the only way you can square the circle, and you know Democrats are going to go for that.
Yeah, here's what I don't get, because when this whole thing went down, the insurance companies were supposed to be getting protected as part of the program. They said, there's no way we're going to go along with this and tell people, the American people, that it's good for them unless you basically factor us in and make sure we don't lose too much money. But now they are.
That went out the window. Republicans got rid of so-called risk corridors. Remember that? They said they didn't want to do that. And now these insurers are highly exposed, and they're saying that they can't afford it. Look, at the end of the day, it's not just affecting the cost for people on Obamacare. Costs for people who have health care insurance from an employer are also seeing their costs rise too. And that's because of the Cadillac plan tax that's going into effect. It's being passed right on to consumers. Everybody's costs are going up. This is in direct contravention to the promises the president made. You can keep your plan, you can keep your doctor, it's not going to cost you a lot of money. Do you remember that the president promised that you would pay no more for Obamacare coverage than you would for a cell phone, that it wouldn't add a dime to the deficit? If you go back and you look at those promises today, it's astonishing what he thought he would be able to accomplish here, and clearly what has not happened.
They also said initially some costs would rise, but that over time it would start to pay off. Can they still make that argument?
I don't think so. We are still far, far, far away from getting everybody covered in this country, and the costs are already spiraling out of control. When you look at this in depth, you see a system that's really not working. And you can think back to when they put this in place. They put this in place a month after the recovery began, a fifth of the economy thrown into turmoil. Think about it. It was really wrong-headed. The timing was bad. And now we're finding that the program itself is just not working.
All right, Jerry, thank you very much. Good to see you. We'll see you on the Business Channel.
So